My name is Seth Powers. I'm Director for Student Support Services for Moore County Schools. And I'm pleased to be able to talk with you this afternoon about student access to school nurses, athletic trainers, school police officers, and mental health support services. We're going to start by taking a look at our school nursing program and our number of school nurses. Moore County Schools currently has 14 school nurses and 1 school health coordinator who is also our head nurse. We've actually added 7 nurse positions since 2015-16. That's thanks in large part to a partnership with First Health. First Health helped us out for 3 consecutive years by adding an additional nurse position when Moore County Schools paid for a nurse position. So that accounted for 6 of those 7 positions. The 7th position actually came from some creative budgeting where we had been contracting for an additional school nurse to support some individual EC student needs at 2 of our schools, and we decided that it would be a better use of our funds to pay for that school nurse from Moore County Schools funds so that the nurse could also serve other Moore County School students, not just those specific EC students. So that accounts for the 7 new positions. In 15-16, our Moore County Schools student to nurse ratio was 1 to 1,444, which ranked Moore County Schools 110th out of 115 school districts in the state. Currently, with the addition of the school nurses that we've had over the last few years, in 2018-19, Moore County Schools has a student to nurse ratio of approximately 1 to 900. Our goal is to reach the state recommended standard of 1 to 750. That's nurses to students. We would need to add 3 additional nurses to reach this goal. The cost of 3 additional nurses would be approximately $60,000 each, or $180,000 for all 3 per year. I think it's important to point out why school nurses are important. Trends indicate an increasing number of medically fragile students in our school system with chronic conditions and special health needs. Social morbidities such as drug and alcohol abuse, tobacco use, and obesity continue to rise. There are more mental health needs in our schools, and we also have more working parents than we ever had. I also want to point out some statistics from our nurses and our nursing program. During the 2017-18 school year, 14 Moore County Schools nurses provided approximately 10,000 contacts, which include phone calls, home visits, emails, texts, etc., over 27,000 office visits, 2,457 individually written health care plans, and in addition, 92% of office visits were returned to class, increasing student seat time. Research shows that when a nurse is not present, return to class rates can be as low as 70% or lower. So we can see the important role that school nurses play in our schools. Now let's look at next steps related to our nursing program. One challenge that we have is providing nurse coverage for an additional school in 2019-20. With the opening of McDeeds Creek Elementary, we'll now be serving 24 schools instead of 23, with the same number, 14 nurses for next year. With the opening of the new consolidated Southern Pines and Aberdeen elementary schools in 2020-21, our number of schools will then drop back to 22. However, our needs will still persist as ratios are based on student numbers and not the number of schools in our district. We do want to seek to add 3 additional nurses. That would bring the total staff to 17, which would give us the numbers needed to meet the state recommended student to nurse ratio of 1 to 750. A critical need is also a full-time nurse at Pinehurst Elementary. Pinehurst Elementary next year will be our largest school without a full-time nurse. Next, let's take a look at athletic trainers. In 2015-16, Moore County Schools added athletic trainer positions thanks to a partnership with Pinehurst Surgical Clinic. The funding of positions is broken down as follows. In 2015-16, Pinehurst Surgical Clinic actually paid for all 3 trainers to have 1 trainer a full-time certified athletic trainer at each high school. In 2016-17, Moore County Schools took on the cost of one of those trainers, and Pinehurst Surgical paid for two. In 2017-18, Moore County Schools paid for two trainers, and Pinehurst Surgical paid for one. And in 2018-19 and moving forward, Moore County Schools now pays for all three trainers. Again, I think it's important to note why our athletic trainers are important. We have the need for increased student-athlete health accountability. The increase in the number of sports and the increase in the number of sports-related injuries continue to rise. The need to diagnose and closely monitor head injuries and concussions. Athletic trainers provide for injury prevention, treatment, and rehabilitation. And I'd also like to point out at Northmore High School, which is our smallest high school, there alone, 305 significant athletic trainer contacts with student athletes were reported in 2017-18, and those are contacts that went beyond just a quick follow-up visit for a minor injury. So we can see the importance of our athletic trainers to our high schools. Next steps, we would certainly like to see our athletic trainers placed on a salary scale. Trainers are 10-month employees and make $32,000 a year plus a $1,600 stipend for 2 weeks of summer work. Their salary has been the same since Moore County Schools began utilizing athletic trainers in 2015-16. So our hope is possibly with the new classified salary scale that's being considered by the board, that could help take care of that need to have them placed on a salary schedule. We also want to continue our relationship with Pinehurst Surgical Clinic. We meet with them annually and talk more about other things that we might do to help support our student athletes. I do think they would be open to possible future partnerships where we might explore options for a fourth athletic trainer to support additional needs at our three high schools. There are times when we have multiple athletic events obviously going on the campus at the same time, or trainers are required to travel with football teams, and there's need for additional coverage. That additional fourth trainer could help with that coverage at all three high schools and could also provide some level of support at the middle school level as well. Next, I'd like to share a little information about our Moore County Schools Police. Moore County Schools is one of two school districts in the state with their own police force. We have a chief of police and 13 full-time officers. We maintained 3 positions this year and added an additional officer through a state safety grant. And our officers are based at our high schools or middle schools, but they also cover elementary and primary schools, although they're not based there. Why are Moore County Schools Police important? They provide for increased safety and security on school campuses. They build relationships with students and staff. They build rapport with outside agencies and promote interagency support. They operate our Moore County Schools Second Chance program that gives first-time offenders an opportunity to take classes and provide community service in lieu of charges and to have those charges dismissed. And they increase the increase in school violence and active shooters that we've seen over the last several years is certainly a factor and illustrates the need to have a police officer on campus for safety and security reasons. Our police department has recently added Officer Mario Kaiser with a new position from the state grant. Mario is assigned as a second officer at Pinecrest High School. We're in the process of filling a position that recently became open after a resignation. Once filled, that officer will cover Southern Pines Primary and Southern Pines Elementary School exclusively and split time between those two schools. Next steps related to Moore County Schools Police staffing. Obviously, our long-term goal would be to have a full-time officer on every Moore County Schools campus to ensure the most the most secure and the safest campus possible. We know that that's not possible at this time, but what we would like to propose is 6 additional officers that would allow for constant coverage on all secondary campuses except Elise, and that would also allow for halftime coverage on each elementary campus, including Elise. With our current setup, when our officers are called away from a middle school or a high school to deal with a situation at an elementary school, those secondary campuses are left without coverage. So additional officers would allow us to always have coverage on our secondary campuses, and then also allow for additional coverage on elementary campuses. Understanding that even 6 additional officers may not be possible, there is an option for 3 additional officers that would again allow for constant coverage on all secondary campuses except Elise. Elise is our smallest middle school. It's located inside the town of Robbins. Is only a block from the Robbins Police Department. So we feel comfortable with the coverage at Elise being the same as our elementary schools at this time. But that 3 additional officers would also allow for 1/3 coverage on every elementary campus, which would also include Elise. That means with 3 additional officers, every elementary campus would have a police officer on campus all day, every 3rd day. Next, we'd like to take a look at our district mental health professionals. We'll start with our school psychologists. Moore County Schools currently has 11 school psychologists. There's a nationally recommended ratio for school psychologists of 1 to 500 to 700. That range between 500 to 700 is actually based on school needs. You know, some schools have a need, have more students with particular issues, behavior issues that may require more assistance. So that's the reason for the variance there. That ratio is based on both research and best practice by NASP, the National Association of School Psychologists, which is generally recognized as the national standard by districts across the nation as well as across the state. Our Moore County Schools ratio of school psychologists to students, 1 to 1,150. So quite a distance from that nationally recommended ratio. In order to reach that ratio of 1 to 700, Moore County Schools would need 7 additional psychologists. Why are school psychologists important? Well, they're qualified mental health professionals, and we have more mental health and behavioral health needs in our school systems than we ever have. They're experts in psychology and education. They provide consultation and staff development to school staff and parents. They provide individual and group counseling. They're experts in behavior management. They advise at a system level, and they also help to evaluate students for special education eligibility. The next group of mental health professionals I'd like to address are our school counselors. Moore County Schools has 37 school counselors. The nationally recommended ratio for this group is 1 to 250. Again, that ratio is based on both research and best practice from the National Association of School Psychologists. Our current Moore County Schools ratio is 1 to 340, and in order to meet that nationally recommended ratio, we would need 15 additional counselors. I'd also like to point out the importance of school counselors on our campus. Like psychologists, they're qualified mental health professionals. They provide our school counseling curriculum, which includes 9 essential guidance standards. They provide responsive services, both small group and individually counseling, and create behavior plans. They consult and collaborate with staff, community, and parents. They provide crisis counseling and prevention. They provide community outreach and program planning in terms of our student support teams, MTSS, our school improvement teams, 504s, and PBIS. And they also provide professional development to our staffs. The last group of mental health professionals in our schools I'd like to discuss are school social workers. Moore County Schools currently has 11 school social workers. The nationally recommended ratio here is 1 to 400. Again, that ratio comes from the National Association of School Psychologists. Our current ratio in Moore County Schools is 1 to 1,150, and we would actually need 21 additional social workers to reach that recommended ratio of 1 to 400. Why are our school social workers important? Again, they're qualified mental health professionals on our campuses. They help students improve their academic achievement. They help students improve social, emotional, and behavioral competence. They provide small group and individual counseling. They work with homeless students and their families to improve access to school opportunities. They work with students and families to overcome barriers to school success. And they also track and intervene with school absences. So, next steps related to our school mental health professionals. Again, we have the challenge of providing a social worker and a psychologist coverage there for an additional school in 2019-20 with the addition of McDeeds Creek Elementary. Increased staffing to move toward nationally recommended ratios for school mental health professionals. And our most critical need is an additional school social worker followed by a school psychologist. We're hoping for a continuation of the state safety grant that started last summer to provide additional positions for mental health professionals in schools. Moore County Schools actually gained one position through that grant for this year. That particular position was used to add a position to the district's new behavioral health intervention team, also known as the BHIT team. If funding were continued or increased as suggested by the House Select Committee on School Safety, and we were to gain another position for the coming year, it would be used for an additional social worker because that's our area of greatest need. If by chance, through that increased funding, which has been recommended to be $52 million versus $30 million from last year, if we were to gain two positions, that second position would be used to fund an additional school psychologist. I mentioned our behavioral health intervention team. I'd like to share a little bit more information about that team. It is new to Moore County Schools this year. The team actually began work in October. It's made up of 4 qualified mental health professionals. 2 are both school licensed and clinically licensed social workers. We have 1 behavior specialist, and we have 1 vacancy on our team at this time that's in the process of being filled. 2 of those 4 positions are funded through Sandhills Center for Mental Health and Moore County. 1 position is funded through the state safety grant that I previously mentioned, and 1 position is funded through a PRC 29 grant that was formerly only be able to use for support to EC students, but now also allows support to regular education students as well. The BIT team is centrally based and serves all schools as needed. To share a little bit more with you about how they operate. They focus on prevention, early intervention, and response to student mental health needs. They're available to respond to emergencies that would not diminish the staff and services available at other schools. They also carry a caseload and provide therapy as kind of a bridge until an outside provider can be secured. So there are times when outside services can't be secured in a timely manner. Our BIT team can actually take on students, see them provide therapy on a weekly basis as we work to connect them to an outside provider so that they can continue to get therapy through them. Just to share a little bit of data related to our BIT team, and this is from October 4th of 2018 through January 8th of 2019, so basically over about a 4-month period. The BIT team has staffed 29 BIT referrals, performed 72 counseling sessions, made 23 parent contacts, provided 75 consultations, supported coordination of care 42 times, participated in 20 observation support team meetings, and 5 home visits. So when we put all the mental health needs together, we might ask, well, why is mental health support so important? Well, here's some statistics just from Moore County Schools for the first semester of 2018-19 that illustrate that importance. Our district during the first semester of this year had 41 Columbia Suicide Severity Rating Scales administered. We had 1 student suicide, 73 alerts from our email monitoring system related generally to self-harm, 86 referrals to school counselor or social worker in Educator's Handbook, 5 referrals to outside agencies from Educator's Handbook, 4 student deaths where 24 specialized instructional support personnel were mobilized to support students and staff on those campuses in the aftermath of those deaths. We had 11 students hospitalized, 7 students put on homebound, 41 reports to Child Protective Services, 4 threat assessments completed, and 29 BHIT team referrals. Next steps related to our behavioral health intervention team. We want to continue to examine and refine the systems and processes with our current 14 member. It was new this year. It still is relatively new. We've developed a referral process, and we're still working to refine that and improve it, and we continue to do that. We would also like to consider the addition of a substance abuse counselor certification for at least one of our team members. We certainly recognize that substance abuse issues are an issue for some of our students at different schools. But we do want to also share that no additional staffing for our BHIT team is needed at this time. That completes my presentation, and thank you for your attention.